Complete endoscopic sphincterotomy with versus without large balloon dilation for the removal of large bile duct stones. Randomized multicenter study. Introduction. Endoscopic sphincterotomy was first described in 1974, yet is still the mainstay of therapy for common bile duct (CBD) stones. However, 10% of patients have CBD stones that are difficult to extract and require mechanical lithotripsy. As mechanical lithotripsy is not only a technically challenging procedure, but also time-consuming and costly, endoscopic sphincterotomy plus large balloon dilation, ESLBD, was developed in 2003 as an alternative method. There is recent consensus that this procedure is safe. However, there is an ongoing debate over whether it is superior to the conventional endoscopic treatment of endoscopic sphincterotomy with or without mechanical lithotripsy for CBD stone treatment. In particular, the technical steps and explicit indications for ESLBD in the therapeutic strategy for CBD stones are still unclear. For instance, most authors recommend that ESLBD should involve a small endoscopic sphincterotomy with large balloon dilation in order to decrease procedural morbidity. Moreover, most relevant randomized studies have included patients with CBD stones of any size, whereas the real medical issue is to determine the optimal adjunctive technique in cases of failed CBD stone extraction after standard endoscopic sphincterotomy. To help resolve this issue, the authors conducted a large multicenter study to compare ESLBD with the conventional treatment of endoscopic sphincterotomy with or without mechanical lithotripsy for the extraction of exclusively large CBD stones. This study is the first randomized multicenter study to evaluate ESLBD in patients with exclusively large CBD stones. Background and study aims. Endoscopic sphincterotomy plus large balloon dilation, ESLBD, has been reported as an alternative to endoscopic sphincterotomy for the removal of bile duct stones. This multicenter study compared complete endoscopic sphincterotomy with versus without large balloon dilation for the removal of large bile duct stones. This is the first randomized multicenter study to evaluate these procedures in patients with exclusively large common bile duct CBD stones. Patients and methods. Between 2010 and 2015, 150 patients with one or more common bile duct stones greater than or equal to 13 millimeters were randomized to two groups: 73 without balloon dilation, conventional group; 77 with balloon dilation, ESLBD group. Mechanical lithotripsy was subsequently performed only if the stones were too large for removal through the papilla. Endoscopic sphincterotomy was complete in both groups. Patients could switch to ESLBD if the conventional procedure failed. Results. There was no between-group difference in number and size of stones. CBD stone clearance was achieved in 74.0% of patients in the conventional group and 96.1% of patients in the ESLBD group, p less than 0.001. Mechanical lithotripsy was needed significantly more often in the conventional group, 35.6% versus 3.9%, p less than 0.001. There was no difference in terms of morbidity, 9.3% in the conventional group versus 8.1% in the ESLBD group, p equals 0.82. The cost and procedure time were not significantly different between the groups overall, but became significantly higher for patients in the conventional group who underwent mechanical lithotripsy. The conventional procedure failed in 19 patients, 15 of whom underwent a rescue ESLBD procedure that successfully cleared all stones. Conclusion. Complete endoscopic sphincterotomy with large balloon dilation for the removal of large CBD stones has similar safety but superior efficiency to conventional treatment and should be considered as the first-line step in the treatment of large bile duct stones and in rescue treatment.